Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan and today we're going to discuss a very important topic in intensive medicine, that is the pulmonary emergencies that you're going to get along, and working as a physician you must be well versed with how do you identify these cases of patients who are suffering from shortness of breath, difficulty in breathing, and how are you going to basically diagnose these particular cases on the basis of the clinical features as well as the laboratory investigations. So starting off, the outline of the lecture basically consists of the basic underlying pathologies that we're going to go through. Specifically in today's lecture, this is the first part of the pulmonary emergencies that we're going to discuss, compromising of the basically the inflammatory conditions consisting of asthma. We have the chronic obstructive pulmonary diseases, and then we have the infectious states ending up in the fatal conditions. For instance, pneumonia and chronic bronchitis are one of the conditions that you're going to go through, and what are the differential diagnosis, the set of signs and symptoms, and the particular complications that the patient can suffer from, and what are the treatment modalities that would be discussed over here in this particular lecture. Moving on, we'd be discussing and showing you how do you distinguish between the underlying pathologies and what is the chronic process that is going on in the acute asthmatic attacks, and basically what is the pathology that the patient is suffering from if he or she is a diagnosed case of asthma. So how are you going to differentiate between that? We're going to look into these particular factors, and then obviously the medical history that we're going to look for. So you are basically focusing on the risk factors over here. Either the patient is admitted to the ICU, or there is this positive history of smoking that is present in the patient. So you're going to look for these risk factors as well over here. Then we're going to differentiate between the different clinical pictures. There is a variety of pictures ranging from the pink puffers. Basically, these are the patients who are suffering from emphysema due to the chronic obstructive pulmonary diseases. And there's this typical facial congestion that is noted down, and that is how we are going to differentiate between the pink puffers and the blue bloaters. Pulse oximetry is the definitive lab investigation. Then we have the differential diagnosis that we're going to discuss over here. How are you going to differentially diagnose for the children? That is discussed in detail over here. The treatment guidelines are given in detail over here. Moving on, we have the treatment modalities that are discussed in detail over here, ranging from the pulmonary infections. It is one of the states that would be discussed in detail, acute bronchitis, and we'd be discussing in detail the pneumonic conditions as well. So you can watch this lecture as well as a variety of other lectures by subscribing to our website sqadia.com, and you can even start your free trial right now.